Okay, this is Dr. Domanskis. We're in California now, and we're going to be doing a little bit of liposuction underneath the chin. And you can see our young lady here has a little bit more fullness. You want to bring your chin down a little bit. You can see where it is. So what we're going to do is we're going to put local anesthetic in here. We're going to do it totally under local. She's awake, right? You're awake. Okay. And make a small little cut here, and then we're just going to take that out for her here. So watch us while we do that, and the first thing we're going to do is we're going to start with a little bit of local anesthetic, and we use a very, very tiny little needle, and here we go, a little stick, I'm sorry. Okay, here's a little tiny little needle over here. Yeah, don't move around too much though, Michelle. Okay, just turn a little bit over here, and we'll put another little one here. And this is a local anesthetic, and it has bicarb in it also, so basically it shouldn't burn as much. Then we're going to use a slightly longer needle. Why don't you turn a little bit this way, but she shouldn't feel this now because it's fairly numb. In that one spot anyway. Doing okay? Yeah, it's best not to move around. Doing okay? Okay. Here. Okay, so what we've done is I put the local anesthetic in through here, and a lot of times it has epinephrine in it, which tends to blanch the skin, so you know that that it's working there. And I make a small little cut. That's where we're going to enter the cannula, and then go ahead and do the liposuction. And you can see the cannula is small. It has a couple openings in the end, and it'll go through a machine and go into the suction. Okay, now. Basically, and don't be afraid because it makes a lot of noise. Okay, here we go with the noise. Okay, so we go ahead and enter this right here. Okay. Yes?
Yes.
And you can see the fat coming out there through the tubing. A little bit of blood in it, but okay, and already you can see that this area is a little bit, has more definition, and this area is fuller over here. So I'll just go ahead and do a little bit more over there. Yeah, it's just got a nice definition coming out. Okay, there we go, a little bit more. And I'm following the cannula to make sure it's in the right position. Okay, she's a little bit fibrotic. You haven't had any liposuction there before, have you? No. Yeah, okay. And you can see that, again, she has nice definition here, okay, and there's no definition over here. So we've gone all the way to here now, and all the way here. Okay. Okay, now we'll go to this side. This here. Okay, here we go again on this side. Doing is we're scraping the fat as well as removing it, and there really isn't that much fat there because a lot of it tends to probably be vaporized, but enough that it makes quite a difference. And we're obviously above the muscle, so we're not damaging anything. Okay, and you can see that she has a nice jawline now. You'll be able to see it later on Instagram. Okay. And so again, here you can see that there's a nice swoop, and then once you put your chin down a little bit, and you can see that most of that's gone. Okay, she's got some swelling there, and I think I will go a little bit further, okay, here, just to make sure that we get the best result we can for her. Okay, just pick your chin up a little bit. I'm not hurting you at all, am I?
No.
No. Okay, great. Let's go a bit more. But we got the bulk of it down already. And actually what I'll do is I'll switch to even a slightly smaller one. A slightly smaller cannula. It has 3 openings there too. And we're going to do this just for a little bit more refinement. Do the same small one. Pretty good. And you're gonna be all done. Okay, so and I don't have my patients wear the big bandage overlying them, simply because of the fact that, again, it's sort of obnoxious and it really doesn't really make a difference. So what we'll have her do is we'll get some ice for her right away, and we'll put the ice over the area, and normally what will happen is that the next day it'll look pretty good. Then the swelling will be there till about 7 days, and it'll start going down after that. But she'll notice the result obviously right away, as we notice. And what I do is I put just a little butterfly over the opening. And it's going to really heal very nicely for her. Okay, we're all done? Is that good?
Yeah.
Wasn't too bad?
No, it's
No. Okay, thank you.
Thank you. Oh, it looks great. Wow. Oh. So it is a big difference.
Big difference, yeah.
No, it looks great.
Yeah,
Thank you
that's
so
good.
much.
No problem. And we didn't hurt you, did we?
No,
No.
no,
Very
it was
easy.
fine. It was fine.
That's great.
Yeah.
So as I mentioned to you now, you just put ice there.
Okay.
Okay, tomorrow it'll be fine, but then it's going to swell up to 7 days, and it's going to start going down after that. It may be hard. You probably won't get a lot of black and blue, as I mentioned to you, maybe a little bit of yellowness.
Okay.
And also you shouldn't eat like, steaks or anything like that for a couple of days, okay? And I would probably, as I mentioned to you, don't exercise for, probably a week because you don't want black and blueness. But,
Sure.
but then it should go back. It looks
Okay,
good.
back
Looks
to
good. I'm
normal.
glad.
Thank you
Okay.
so much. Thank you, Doc.